Today, we're jumping right into a real medical detective story. We're looking at a condition that's an absolute master of disguise, one that throws out clues that point in all the wrong directions. We are unmasking Pancoast syndrome.
Okay, so picture this. A patient comes in with this nagging shoulder pain. Then their hand starts to feel weak. They can't grip things like they used to. And, to top it all off, they notice one of their eyelids is kind of droopy. I mean, these things seem completely random, right? A shoulder issue? Something neurological? What in the world could possibly connect them?
And here's the twist. The thing that makes this case so fascinating. The answer isn't in the shoulder, or the hand, or the eye. Nope. The real culprit is actually hiding at the very, very top of the lung. And that is the central puzzle of Pancoast syndrome.
So, let's start with why this is such a confusing case to begin with. The biggest problem with Pancoast syndrome is that, at first, it doesn't act like a lung problem at all.
I mean, think about it. When you hear lung cancer, your brain probably jumps to coughing, being short of breath, that sort of thing. But with Pancoast syndrome, those classic signs are often nowhere to be found in the early stages. Instead, the person just seems to have a case of shoulder bursitis or maybe a pinched nerve. And this misdirection, well, it's a huge problem because it means the real diagnosis can get delayed, and that delay is critical.
So now, let's pull back the curtain and meet the hidden culprit behind this whole mess of symptoms. The Pancoast tumor itself.
It's really important to get one thing straight here. There's the Pancoast tumor, that's the actual cancerous growth, usually a type of non-small cell lung cancer. Then there's the Pancoast syndrome. That's the collection of symptoms the tumor causes. So the tumor is the cause, the syndrome is the effect. You can think of it like this. The tumor is the villain, and the syndrome is the trail of clues it leaves behind.
So, how can one little tumor create so much chaos? Well, it's all about location, location, location. The very top of the lung, what's called the apex, is an incredibly crowded neighborhood. I mean, it is prime real estate where you've got nerves, blood vessels, and ribs all packed in super tightly together. So a tumor growing there doesn't have anywhere to go before it starts crashing into its neighbors.
And this is where it all clicks. This is the big aha moment, where we connect the dots and see exactly how that tumor's location creates that totally baffling set of symptoms.
So here's how it goes down. First, the tumor starts to elbow its way into the brachial plexus, which is that big bundle of nerves for your arm. That's what causes the radiating pain, the weakness, and the muscle wasting in the hand. Second, it can start to mess with the sympathetic chain of nerves. This causes a classic trio of symptoms called Horner syndrome, that droopy eyelid, a tiny pupil, and less sweating on that side of the face. And finally, as it keeps growing, it literally invades the ribs and vertebrae. And that's what triggers that deep, relentless shoulder pain that is so often the very first complaint. Okay, so with all these confusing clues all over the place, how did doctors finally solve the mystery? Well, they turned to their investigative toolkit, which mostly relies on some pretty advanced imaging. The investigation usually starts with a simple chest x-ray, but honestly, the tumor can be super subtle, really easy to miss. It might just look like a little shadow at the top of the lung. So the next step is a CT scan. That's way better at showing the tumor's size and if it started to get into the bone. But the real star player, the MVP of this investigation, that's the MRI. Because this whole story is about nerves and soft tissue, the MRI is hands down the best tool for seeing exactly how far the tumor is pushed into the brachial plexus and all those other structures in that crowded neighborhood.
Now, images can point fingers all day long, but you need definitive proof. The gold standard to absolutely confirm the diagnosis is a CT-guided biopsy. They guide a needle right into the mass to grab a tissue sample, and this test is incredibly effective. It nails the diagnosis in over 90% of cases. So once the diagnosis is locked in, the whole focus shifts. It's time for a complex and, frankly, aggressive treatment plan that's designed to take on this very unique type of cancer.
Today, the standard of care is something called trimodality therapy, which is just a fancy way of saying a three-pronged attack. It starts with chemotherapy and radiation before surgery. The goal here is to shrink the tumor, to try and pull it away from all those vital structures to make it easier and safer to cut out. Then comes step 2, the main event, a really complex surgery to remove the tumor and everything it's touching, ribs, nerves, part of the lung, all in one single piece. And finally, after the surgery, more chemotherapy might be used just to mop up any stray cancer cells that might be left behind.
And here's the bottom line, and it's a big one. This aggressive three-part therapy has made a huge difference, leading to about a 40% 5-year survival rate. Now that number might sound a little sobering, but you have to understand it's a massive leap forward from where things used to be. And it just hammers home why catching this thing early is so incredibly important. Because by the time those telltale neurological symptoms show up, the cancer is almost always considered locally advanced.
All right, so after going through this whole medical mystery, what's the one thing, the single most important thing to remember about this master of disguise?
It all boils down to this one single phrase. The absolute defining feature of Pancoast syndrome is having these really obvious neurological signs, the arm pain, the Horner syndrome, while at the same time having almost no typical lung symptoms early on. That right there is the diagnostic pearl. That's the key that unlocks this entire mystery.
And that really leaves us with one final, pretty big question to think about. The story of Pancoast syndrome is a powerful reminder that our bodies are unbelievably complex. It really makes you wonder, doesn't it? What other serious conditions might be out there hiding behind symptoms that we might just brush off as common, everyday aches and pains?